support with this. Bank of Ann Arbor, in particular, has been a great sponsor and has really helped the community over the last several weeks, has helped rapidly get people funds through PPE and other programs. And so I want to thank them. And they've also been a very active member of the community in terms of just supporting all kinds of resources. So I'm not sure if anybody's on board yet from the Bank of Ann Arbor. I want to thank them for their efforts. And then also Raymond. Anybody here from Raymond yet? Can't say, but they have helped the community. They're an accounting firm, been very busy, obviously, with, again, trying to get people's taxes filed and get them qualified for the programs. We don't have anybody here from Zingerman's. I haven't really been too much in touch with Zingerman's, but I'm very concerned about this major institution in our community that's been number one supporter of so many programs. And I just want to be sure that we're all doing what we can to order from the food vendors, not just Zingerman's, but all of them really need help. And actually, we're going to do a session on the food industry coming up in a week or two. If you people know people, the following sessions that I want to do that I'm looking for resources. One is on food and maybe food and entertainment, but what's going to happen to reform those industries and how do we keep places alive like Zingerman's and Morgan and York, some of my favorite places to go, so that they can get through this really difficult time. What do they do about bringing people back into the workplace who are going to be really affected? It's going to be really a strange world. I mean, walking into a restaurant that's got to be disinfected, met by people with masks. We might look better at staying home and eating in the future when we have to face that. I also want to do one on sports. Sports is a huge part of our community, and both I'm going to be focusing on spectator sports. So I hope to get some people from U of M, Lions, Tigers, seeing what's coming up in terms of how they're hoping to put together a season next year. I think it's really difficult for people to get by living at home, but especially for us guys living at home without sports. I've even succumbed to watching the Michael Jordan special, which he's been my number one nemesis over the years as a Pistons fan, but it's a good series. So I want to formally kick this off. The format this morning is going to be our speakers are going to have a few minutes to answer some of questions that are on people's minds, both not so much take questions, but talk about some of the state of the situation from their points of view. We have Rob McCurdy, Lee Benjamin, Dr. Stephen Aronson, and Dr. Keenan Bora, I should say, and they're going to each address for a few minutes, and then we're going to break into small groups. I want to thank Emily Freund, who's been a great assistant to me and is going to help us break into small groups to talk about this after the major presentations. Then we're going to break back into Q&A for the last part. And we're scheduled to stop at 9, but I think we're certainly going to keep the conversation going until people feel like they want to get back to whatever it is they have to get back to. With that, Rob, why don't we start with you this morning? And this is the second time that you've done this, so I thank you very much. And maybe you could kind of frame this for us this morning in terms of how things are going with
Sure.
medicine.
Yeah, so
Dr. Rob McCurdy, maybe you could just introduce yourself.
Oh, sure. Yeah, so I'm Rob McCurdy. I'm an ER doc. I've been primarily at St. Joe's in Ann Arbor for about 25 years, and I've had various roles there. Medical director, department chair, and just finished chief of staff last December. My role now is with our national company, which is Envision. Envision provides physician staffing for anesthesia, ER, radiology, and a couple other practices. And we have sites across the country. My role is senior VP for Michigan, so I have 21 ERs across the state. So when I spoke, I don't know, it was about 5 weeks ago, I think, Rob.
Yeah.
We were kind of getting into COVID season, and some of the issues that we were dealing with then was trying to get enough PPE to the sites, figuring out how we were going to safely take care of patients when they arrived, getting enough critical care staff and equipment. And, a lot of that we're more or less at a steady state. I think there seemed to be a trending down of COVID cases, maybe a little bit early to say that for sure. But the things that were an issue 5 weeks ago are less of an issue now. We seem to have an okay supply of PPE. I think at least my providers in the state feel relatively comfortable with the process. We're doing a lot of telemedicine. So we're keeping, the patients that are being seen separate to some degree from the providers and keeping people safe. I think my main focus right now, so we've realized that we did a really good job of communicating to the public to stay home. Multiple messages from everyone to stay home, including my, national group, American College of Emergency Physicians. And in addition to this, people are seeing on the media, they see, the worst of the worst. They see the body bags, they see the nursing and physician staff in New York saying they don't have enough PPE, they don't feel safe. And that has really driven home the point to patients that it's not safe to go to the ER. And unfortunately, what's happened is now we're seeing that people are avoiding care for things like, chest pain, stroke symptoms. There's definitely been an uptick in when paramedics arrive at patients' homes. They're in extremis, increased, DOAs, dead on arrival. So that's my focus now, is trying to communicate with the public to let them know that it is safe to come to the ER. We have, the process is down much better. We have the protective gear. We have, people who are coming in with COVID symptoms separated from non-COVID, and not to ignore these emergencies. But, it's an uphill battle, I think, because people have had this message for 5 or 6 weeks. And, I think what struck home was I have a neighbor whose kid had a scalp injury, like a 4-inch gash in their head, and it clearly needed sutures. And she absolutely refused to go to the ER because she was scared of having her child get COVID. And maybe that's not an emergency condition, but that's kind of what we're up against. So part of my focus right now, and this is including having, meetings with community groups like this to try and get that message out to people that we can provide safe care for them in the ER.
Thank you. Well, let's go on to Stephen. And by the way, there's a chat function down here, and I encourage people to pose their questions. It's I'm getting the knack of trying to manage these meetings, but I think it's easier if the questions are posed. I will call on some of you to ask them, but it's an awkward process to try to get sound and on and off. But I'm going to go to my friend Stephen Aronson. Dr. Stephen Aronson is a psychiatrist at the VA and chief of psychiatry consultation. Is that the correct term? Yep. Yes. Okay. So can you give us an update? You have a couple of perspectives, Stephen, including a personal one.
Yes. So I know this illness from the inside as a patient, as survivor, as well as professionally. As a psychiatrist who does consultation work, I wear scrubs to work. I wear a white coat on the wards. I'm in the ICU, the ER, the medical surgical units, doing psychiatry consultations. As most people here probably know, the VA is a major training site of the University of Michigan. So we have our consultation psychiatry and geriatric psychiatry fellowship training programs partially based here, as well as at University Hospital. So what I want to talk about is that my own personal experience, and my goodness, as the many weeks have passed since my recovery, I pinch myself. I don't usually see myself, I'm like to think I'm a little bit on the moderate side and not usually a early adopter. Well, part of that may be technophobia, but I was, I think, the first or third in the county diagnosed. And I think the day that I went to do my testing in the beginning of March, I think we had 226 cases identified in this country. At the time, we were all drinking the Kool-Aid that this was a disease that is going to affect in particular people who are vulnerable because of age, because of pre-existing conditions. And we know to a large extent that's true, and I certainly don't want to speak beyond my own scope with the wonderful ER physicians here or the other members of the panel, but I think everybody knows that we have been so struck and horrified by how this disease also affects horribly younger people, sometimes without pre-existing conditions. And you know, the bottom line, I think, is that this is a virus that is writing its own rules every day. I'm back at work now. I think I'm completing my 7th week back at work, and I'm struck by the impact, and this already is one of the excellent questions in the chat just a couple of moments ago, yes, obviously we're concerned about patients and their families and their support systems and those who are not coming in for needed care, as Rob was mentioning earlier, but also the impact on the staff. And one of the excellent questions in chat just a moment ago was medical staff burnout. There's what's called the Lombardi model in one of the areas in northern Italy that was hit, where smart, astute physicians and healthcare administrators allowed docs to be on for a week or two at a time and then off for 10 or 14 days or whatever was appropriate to cover what we understand of the incubation period in order to try to minimize spread. Our services here, our pulmonologists, our intensive care docs who work for a week or two at a time have had the ability, some of them, to then take a week off both for medical reasons, but also to kind of recharge batteries. So, but for those of us, and most of our internal medicine docs, I think it's true of them as well, those who work on the hospital side, not so much the outpatient side, this has been a struggle. This is incredibly, incredibly stressful. A week and a half ago, again, we see patients all over the hospital, including the intensive care unit. My residents and I spent the morning on teaching rounds in the intensive care unit with the intensivist team, the intensive care docs, as well as the palliative and hospice team, as you can imagine, appropriate to what's going on and what the prognosis is for so many of these patients. And again, it was just brought home to me both personally as well as professionally about not just what a bullet I dodged personally, but you know, the incredible effect of this illness. I've also had the privilege for the last several weeks of being able to donate plasma. And in case there's any interest later on, I'm sure some of the other physicians on the panel I'm sure there'll be questions regarding some of the treatments that are in the media. Last point I wanted to make regarding the VA specifically, and I'm very proud of this. Other than one New York VA, my understanding is that we are the #2 VA in the country in the number of civilians that have received COVID positive, that have received care here. We've had, I think at any one time at the height of the surge, we had 20 civilians here. And the fourth leg of the mission of the VA, of course, is to serve the nation at time of emergency. And I think at any one time we had more civilians here on a humanitarian basis than actually veterans receiving care. I will say that the administration of this hospital did a great job in planning ahead of time, and our folks from St. Joe's and anyone here on the panel who's affiliated strongly with U of M can talk about how, thankfully, at least from point of view that I know of VA and U of M, we didn't need to utilize the full contingency planning that we had probably engaged in. Last thing I want to say, and I'm sure we'll get to this in the question period, is that we are now everybody's anticipating a huge, getting back to my primary kind of intertwined theme, huge tidal wave now of emotional effects. Yes, of staff, of healthcare workers, but certainly of patients.
Could you speak to what you're seeing from a psychiatric point of view, Steve?
So we're not really seeing, and maybe this is because people are coming in with illnesses to be admitted through the emergency room or directly admitted to the hospital with illness. If they're COVID related, they're usually so ill that the focus is not on the psychological impact. We're talking about people who are in desperate stages of the disease process. In folks who are hospitalized without COVID, there is some anxiety, but regarding infection, whether in the hospital, and actually more realistically, probably the risk is higher outside, because I think we're doing such a good job of screening folks who come into the hospital buildings and in this country these days. I can't say that we are seeing anything specific to COVID. One of the things that consultation psychiatrists do a lot of work in is what's called delirium, which is usually very temporary confusional states and disorientation that just because the brain is part of the body, and if there's metabolic or infection effects or drug side effects elsewhere in the body, the brain is not immune from temporarily going off kilter. We're not seeing a change or a increased or anything specific in the way of a COVID delirium or what we call a COVID encephalopathy. But, again, this virus writes its own rules, and it's possible that down the pike we're going to be seeing some of that in terms of residual effects.
All right. Well, Keenan, you're up next. What would you like to address? And maybe you could introduce yourself, talk about what your specialty is, and some of the different things that you've been focusing on now.
Sure, thanks, Rob. My name is Keenan Bora. I'm an emergency medicine doctor over at St. Joe's for the last 10 years and a few other hospitals around Southeast Michigan during that time. And I also have a national role with our company as the national co-chair for quality for emergency medicine. And so I try to direct and supervise the services around 650 emergency departments across the country. And right away when this hit, we knew that we were going to need to be playing the whack-a-mole game as far as having resources deployed very quickly to areas that needed it. And so we did make a decision fairly early on to stop elective surgeries at some of our facilities, and then other places have followed, and the national government has done that. So I was involved in writing some of the policies about reopening that. And for those of you who haven't seen it, Governor Whitmer put out her plan for reopening and restarting the economy in Michigan last night. And there are also plans from the White House, plans from CDC. Pretty much everybody's got their own roadmap, but they're all based on some similar sort of ideas, which is basically you have to have increasing incidence, and incidence is the amount of disease that's happening on any sort of day-to-day or week-to-week period, right? So you have to have fewer and fewer people who are getting sick each week. And because of the long period of time during which this virus is in you and not really causing anything, they call that the asymptomatic period or incubation period. You need about 2 weeks. So there needs to be about 2 weeks of decreasing incidence of new disease. And then also there needs to be a decreasing prevalence. So prevalence is the amount of people who are sick at any particular time. And because people can be sick for very, very long periods of time, the prevalence numbers are always going to be much higher than the incident numbers. So, but you have to see them both decreasing and fairly aggressively before you would really consider opening. Then you have to make sure that everybody has enough PPE, the personal protective equipment that Rob was talking about. And fortunately, at least at St. Joe's, we've managed to make sure that we've continued to have enough, but we have had to, on a national level, we've had to contract with companies outside of the country and bring the material in. It's very challenging. But then the third part is testing. And there've been a lot of questions about testing. And I guess I wanted to just talk about that briefly. There are two sort of main tests that you will hear people talking about when they say, can you test for COVID? And one of them is called the testing for the antigen, which is actually testing for the virus itself, or testing for what the virus is made out of. And that the most common tests for those are just give you sort of a yes/no answer. Do you have it or do you don't? And then the problem with those tests are that they're not great. They're not perfect tests. If we took 10 people that we knew from some sort of an omniscient view had the disease, and we ran those tests and we did the test right every single time, like we put the swab in the back of their nose and collected it right and took it to the lab, that test would only be positive about 7 times out of 10. And that's not a great number when you're dealing with something like this. And then you have to deal, when you're talking about testing on this scale, you have to deal with things like supply chain problems, like do we have enough of the swabs? Do we have enough of the reagents? Do we have enough of the testing things to be able to do it? You know, a 7 out of 10 chance of getting the right answer is not great when you're dealing with a disease like this. So what they've done is they've sort of mandated that you have 2 tests done most commonly especially when you're going to be talking about surgery. They have you do 2 tests. And what that does is that sort of allows the holes that might be in the Swiss cheese of the first slice, the sort of the problems that would come through. You hopefully try to have a different test that has different problems, and that goes on top of it. And then not as many things can get through. So you minimize the number of chances of getting the wrong answer. And so those are some of the issues with respect to testing. And I'm sure that I haven't seen it in the chat yet, but I do want to talk a little bit about antibody testing, because I'm sure people will be hearing more and more about that.
Why don't you go ahead and do that? I think that's probably on all of our minds, Keenan.
So there's a lot of questions about antibody testing, what it can tell you and what it can't. And basically, antibody testing is testing for your body's response to the virus. The first question that we often get is, can antibody testing tell me if I've already had the disease? And the answer to that is maybe. The response to your body developing antibodies to this virus seems to be delayed on the order of 1 to 3 weeks. And the response, the degree of response, basically, so the amount of antibodies that your body produces can vary by a factor of about 512. So one person's immune response at about 3 weeks to another person's response at about 3 weeks, they can have different levels of antibody in their system by about 500 times. Wow. So then the question comes, well, what level of antibody do you need to have to be considered immune from this? And science just doesn't know that right now. So you might get, the simplest test, there are about 120 different tests that have been approved nationally for this, but being approved doesn't mean that they've been validated in a way that makes it sound science. And then a lot of times what you get with most of the tests that have been done is you just get a yes or no question about whether or not you have the antibody, but it won't tell you exactly how much. And so
I just wonder if Steve, could you comment on that? Were you tested after you, and what about giving plasma? How does that relate to the testing? Thank you, Keenan, for that information. Well, I'm just going to switch it over for a second here to Stephen.
Right. Yep. So I came back from international travel at the beginning of the month, beginning of March, and I had flu-like symptoms, and I work in the hospital, and I came back just before a weekend. So I knew enough on Monday morning, get in touch with employee health and say, I know not to come to you for a swab, because if I have the flu or if I have corona, I didn't think I'd have corona. So I got tested a day later through by the way, plug here for the Washtenaw County Health Department. They've been amazing. I was one of their pilot patients, I guess, too. So I got tested because I'm a hospital doc. Was positive, was shocked 72 hours later to get the results. and as people know, this has been in the media, and doctors know this very well as well, that there's been CDC guidance which changing in the first 3 weeks of March, if not day to day, but 2 or 3 times a week in terms of return to work or how many days symptom free. So the very conservative guidance at the beginning in the first month or so was to be home for 14 days, to be at least 72 hours symptom free before going back to work and coming out into public. During the first week of my 2-week isolation at home, the guidance was that you're going to need 2 different of the tests that Dr. Bora was talking about, not the antibody, but for the antigen, for the presence of the virus, separated by 24 hours, 2 different tests in order to be allowed back. But of course, as we know, the testing is not as available as we would like. So then we went back to the 72-hour plus, 72-hour symptom-free. So I was back at work, and then very anxious because we all know that intravenous, administration of our own antibody, and this has been something that has been used for many, many decades in medicine and all kinds of illnesses, that this might be something that might help to attenuate people who are desperately ill in later stages of COVID. And it took a while for the different, and I've actually, my St. Joe's colleagues actually been in touch with Beth, who's been running the program over at St. Joe's, because it's been very, very difficult to get the Red Cross American Red Cross local cooperation to the level that we need in terms of getting response. So 28 days after my last symptoms, because I had a positive test for the illness at the start, I was allowed to start donating plasma. So it's available. There are multiple sites now, I think, even in this county. But I needed to have that test originally. And today, I believe, and I can't speak for sure for the blood banks, but I believe the guidance would be that if one had a valid, reliable antibody test and didn't have the original antigen test, I may be out of my depth here on this, Keenan, you can correct me if I'm wrong, then you can donate plasma. But because I had a positive test, then 28 days symptom-free, I could start donating plasma.
Yeah, you would need to have the negative antigen test, so not having any of the virus, and then you need to have a certain level of antibodies in your plasma in order to donate. And that level, as I was stating earlier, is that is highly variable between patients who are even 28 days out.
Right.
I'm going to switch over to Lee. By the way, Steve, I want to say thank you for your input, but also I'm really glad you're well. And you look marvelous. In your blue scrubs there, looks very, very nice. So, I can't hear you.
Yeah. I thank you. I appreciate the good wishes. Remember, I talked a few minutes ago about delirium. My wife is not positive that I'm symptom-free yet, but that's another story.
Well, so far so good. And I have to say that in my own life, my son Adam and his wife Sarah and their 2 daughters all also had COVID, but were not ever able to be tested. They're in the epicenter of Jackson Heights, Queens. And ironically, Adam is an editor for the New York Times, and his covering one of his assignments is he's editor of the coronavirus newsletter. So, but they actually fled from New York City to Philadelphia after they were symptom free, and when President Trump said he was going to close the borders, so close the borders between New York and everywhere else in the country. If you remember that, one of the other fiascos that we've had here. So anyway, they're fine now, and but I worry about how long this seems to play out, Steve. It seems like there's symptoms for many weeks after the initial symptoms. I don't know if you experienced that. You said you still not have your sense of taste and smell back completely?
Correct. I'm having trouble differentiating between different kinds of IPA beer, which I used to be known for. But seriously, that the effect of loss of sense of taste and smell, that lingers. I do have some baseline mild asthma. It's been ridiculous. It's not only deconditioning for being knocked out for 16 days or so. That accounts for the fact that now, 7, 8 weeks later, I'm still significantly short of breath, and sometimes not on exertion, but at rest, which doesn't make a lot of sense.
Okay, Lee, you want to sign on there, Lee? And Lee is going to talk some about the effect of children and some of the new disease that has been showing up. And Lee, if you could introduce yourself.
Absolutely. So thanks for the opportunity, Rob, and to everyone who joined. So I am an emergency physician. I also am a pediatrician and spend a lot of my time with kids in the emergency department. I work at St. Joe's Mercy Ann Arbor and also have a role nationally with Envision with pediatric quality. I want to give a little bit of a picture of what we're dealing with that maybe you guys haven't seen in the media so much, and then I'll talk about kind of my thoughts on kids, and then lessons learned and what we should be taking away. As Rob McCurdy, when we first jumped on the call, he kind of saw my Zoom session and saw that I'm still in the basement of my house where I've been living for the past 6 weeks. I've been coughing for about that long, even though I tested negative, and I definitely was around people who tested positive for COVID before we really knew it was in the area. And as an emergency physician, as a physician, you're trained to be very independent. We can handle anything you can throw at us. Maybe emergency physicians have a little bit of that cowboy, I can take whatever you can give me. And although I have felt pretty good with how things are going, I think it's really becoming tough on my family. So,
can you, Lee, why you're in the basement? Because you're having symptoms? Is that?
Well, initially because I was having symptoms, but now there's really no period in my career where I'll be 2 weeks out from seeing patients. And the fear is if I were to bring it home and contaminate my family, they then can get other people sick and get sick themselves. And a lot of us in medicine, in emergency medicine, are doing some form of self-isolation. With me being symptomatic, early on, it was a very sensitive issue. There was a lot of fear. There still is, to tell you the truth. When we did an informal survey through our emergency department, there were only 4 out of 40 people who responded that they had sick family members. 4 who had symptoms. I was one of them, and I developed my symptoms before we even knew it was here. But only one of us had family members that had gotten sick that felt that they probably got it in the community, not from us. So although I think we're doing a good job in the hospitals keeping us safe and giving us PPE, and we have protocols and processes, I feel incredibly safe at work. I feel more safe at work than if I have to run out to Kroger, to tell you the truth. But it is getting hard kind of living this semi-alternative lifestyle. I do go upstairs, I see my family. I no longer eat my meals in the basement, but down to the long open floor plan house where I can wave to my kids and say hi and talk to them about their day. So getting a little bit rough, but we'll soldier through as we improve.
Lee, I'm going to just intervene for a second because I want you to comment. You're being very safe, but I notice a lot of my friends and are beginning to take a lot more risks. And could you just speak to that in terms of how wise is it to go to Kroger's or to, have friends over in the backyard over, supposed 10 feet distance or whatever?
Yeah, it's a great question. I think what we're experiencing across the country is we're seeing people fatigued by the thought of the social isolation. We're seeing it in emergency departments where doctors, nurses, oh gosh, I just don't want to have to be in and out of my protective equipment all day, every day. And it's still crucially important, I think. There was a question in the chat box on what can the community do for us. The first thing I would say is be very thoughtful of how you are acting. As Dr. Bora suggested, we need the incidence and the prevalence of this thing to start coming down before we reopen. And by being on the cavalier side, as we reopen, we expect that we will see a second wave of infections. We are prepared for that. it's important to go out. You have to have the things you need to leave. You have to have your medications. You have to have food. You have to be able to do the things that take care of yourselves and your family. But just be thoughtful on how we do it. Consider wearing your masks. Lots of hand washing. Don't go places that you really don't need to go just to go. I think that's probably the biggest thing you can do for us in healthcare and for yourselves in the community. If we need to get over this, I think the opportunity is now to really control the spread.
Thank you. Lee, do you want to comment about the other aspects of this in terms of the pediatric viewpoint?
Sure. So in large part, the pediatric population has been spared from this, which is quite unusual. Oftentimes, viral infections tend to be hardest on the kids. I remember I was working down at Duke University in 2009, and that was the H1N1 epidemic. And there was not an ICU bed on the East Coast, pediatric ICU bed that was available. There are life support units called ECMO machines, which can put oxygen in your body and clear the blood of toxins and basically put you on bypass for an indefinite amount of time. There were none of those available on the Eastern Seaboard. This is very different, and children were not at high risk of severe and dangerous illness from this. As a matter of fact, less than 1% of kids who even got sick ended up in an ICU. But now we're seeing things starting to turn, and we're having waves of a fairly mysterious disease that no one's really seen before pop up. And one of those epicenters for this is Detroit and Children's Hospital of Michigan. There's a disease called Kawasaki's disease that is basically your blood vessels are inflamed. And we believe this is a historic disease. We believe it's due to a viral trigger, and then the body's immune system goes a little haywire, and you get this massive inflammatory response. Well, now we're starting to see that in clusters. In Europe, they've had some, New York, and now Detroit, we're seeing it, where the body just has this severe, overwhelming inflammatory response. And even if kids don't get that sick when they actively have the virus, potentially afterwards, once their body is reacting, they're developing this multi-system inflammatory response. Their hearts are failing. They're ending up in ICUs, back on these bypass machines called ECMO. And we're really just getting the first taste of what this is about. So yes, the lay press has shared, and the medical press, that kids don't get that sick from a respiratory standpoint with the virus, but it's just something to be aware of. It's still very rare. If you have kids, it is incredibly unlikely that they're going to get this, but if they have persistent fevers, high rashes, severe symptoms of illness, they need to be seen, because we know that this is out there. The only other thing, I'm sorry, Rob, did you want to ask a question?
Go ahead, please.
Well, I was going to talk, there have been some questions in the chat box, and some people, as the meeting was getting going, are asking, what does the future look like? And we really don't know. But here's the one thing that we do know. It's not going to be the same as it was. It shouldn't be the same as it was. There are so many lessons that we're learning on how we work with our partners, the importance of relationships before the COVID pandemic, on how we very rapidly were able to break down barriers to initiate some processes that would really allow us to optimize our care of patients while protecting our providers. One of them is telemedicine, which has been mentioned a few times here, which can do a number of things currently in the pandemic and beyond. We're using them to screen patients without ever having to be in the same room as them for symptoms. We're using them to complete medical screening examinations. If we have a sick patient who's in our emergency department, we can have a telehealth unit in the room to prevent us from having to go back in and expose ourselves. Frequently, we can communicate with our patients from our desk by a video system, and it's just really impressive. We're now taking that to the outpatient realm, where we can follow up patients who have tested positive or are under investigation. We can reach out to them at home to meet their needs through telemedicine. And this is just one example of a space where very quickly, hospitals, insurance companies, physicians were able to just wipe away the barriers and make it happen when we needed to. And it's that kind of learning and those kinds of relationships and partnerships that are going to need to be sustained after this to really change how medicine is delivered in the country.
Fascinating. I'm going to make a decision that we're not going to go into small groups because there's so many questions here for the physicians. And I think we'll just take those. And several of you, I have posted questions. Is Lisa still there, Lisa Hardy? So Lisa, if you are online, come on and ask your question. Otherwise, I'll read it for you. I'll hear from Lisa. So let me post Lisa's question. If Lisa, you are there, come on. Lisa is a vice president at Blue Cross, and she is a minority, and she's asking about the question of, are you seeing the disproportionate evidence of this disease in minorities in Washtenaw County?
So I can answer that. So actually, when we did the first town hall on this, we weren't sure. It did seem, like the patients were seeing, it didn't seem that there was a demographic shift, but I can tell you that if you look at our ICU, it looks exactly like everybody else's ICU. The people who are getting the most ill from this are the same demographics that other people are seeing. So African American, obesity is a big risk factor. Hypertension, diabetes. So the answer to that is yes.
Okay. Other questions. Rick Reed, you have a question about hypertension. Is Rick still there?
Yeah, I'm here. Sorry, I was muted. Yeah, I've been hearing that hypertension can be one of the most significant underlying conditions that increases one's vulnerability to COVID-19 as far as suffering more adverse consequences from it. So if you could comment on that, that'd be great.
I can take that one, I guess. The largest one actually is age, far and away. Like the difference between the mortality in a 30 to 40-year-old person is about 1/10 that of somebody who's about 70 years old. So age is definitely the largest risk factor. As far as controllable risk factors, obesity and diabetes come in the top two, and then hypertension is number 3.
Okay. Thank you.
Okay. Lee, you wanted to comment on that too, about diabetes?
Sure. There was a question in the chat about type 1 diabetes in children. And the fortunate thing is there's just not a lot of kids getting sick in general. So it's tough to make generalizations about any specific patient population. We do know that those kids that have gotten sick tend to have underlying medical problems, and diabetes certainly is one of them, but there's just not enough data to make a clear judgment on that. I was on a call yesterday with some pediatric emergency folks from around the state, and Children's Hospital of Michigan, again in Detroit, which has been hit pretty hard, is specifically following their diabetic complications. There's a feeling that they're seeing increased complications, but they don't have any firm data on that. It's not yet published. So I think trying to control any underlying disease states as best you can during this and being safe is probably the best answer.
So if you were each to give us a personal piece of advice here of what we could do as individuals, what would be top of mind? We've heard some of the precautions to not to do things outside of the immune, trying to keep yourselves from being affecting others, or what other pieces of advice do you have for us?
So, I would say maintaining your well-being and mental health. So I have a dad who's 87 and he lives alone. He's up in Boyne, and his biggest struggle is the loss of contact with people. he's really struggling with that. He said, I haven't touched another human being in 6 weeks, and that's really getting him down. And of course, anytime that your well-being isn't where it should be, you're more likely to have immunosuppression and pick up anything. So I struggle with trying to help him. We try and do Facebook or FaceTime as much as possible, and but it just isn't the same as being there in person. But trying to focus on your mental and your physical state, I think, aside from the social distancing, is really important.
Other pieces of advice? Steve, what would you tell people?
I would absolutely echo taking care of one's health, one's mental health, trying to remain as connected with others as possible. These are uncharted waters, obviously. Creative ways of using things like the Zoom mechanism. We have a lot of family overseas, and we have 2 different weekend calls, one on a Saturday afternoon, one on a Sunday afternoon with our relatives in the Middle East. We spend an hour. Spend an hour with it's a 3-generation call with 35 people on the call. My wife does
35 people. That's great. Yeah.
My wife does a alcohol minimum. Don't want to give the impression of that much alcohol in our household, but a 5 o'clock in the afternoon, 2-day-a-week happy hour with her friends. Just kind of thing that she used to do anyway, in person, at a local cafe or whatever, late afternoon after work. It's just important to be thinking about keeping the connections up. Those of us who have a job to go to, because we're in a sector of the economy where we need to be present somewhere, or working from home, but having something to do for hours a day. Here too, I pinch myself personally and how lucky I am. But the emotional impact on all of us is not something that can be, there's no way of avoiding that. I keep using the term tidal wave. It's happening. There was a question just a moment ago, just to connect another dot, from Deborah regarding reopening the economy. And I'm not going to make any kind of political statement, but at some point the impact of this illness, so long as we don't overrun the capability of the healthcare system, the effects on the economy, the effects on the individual, exactly what we've been talking about for the last 5-10 minutes, are far from trivial. And we're seeing, I don't think we have data yet on the suicide rate, on substance abuse, on domestic abuse, but these are things that are happening, and it's coming.
Okay.
Yeah, interestingly, I've had 2 calls from pharmacies in the last week trying to verify a script called in under my name for opioids. And I called back and said, no, I've never actually even seen these patients. And then the pharmacy shared with me that over the last 2 or 3 weeks, they've had this big uptick in number of fraudulent calls coming in for things like benzos, Ativan, Valium, and opiates. So I definitely think, in addition to alcohol use, I definitely think there is going to be an uptick in substance abuse when this is all over.
I want to call on a couple other people two Davids. David Tarver's out there, and David Brooks, and both in the Detroit area. And David, I wonder if you could, David Tarver, my colleague from the University of Michigan and an entrepreneur, could you talk a little bit about what you're seeing in your community?
Well, we.
Speak up a little louder, David.
Oh, can you hear me?
Yeah, I've got you now.
Okay. So personally, it's my wife and my daughter and I. We fortunately haven't been affected a whole lot. My daughter went pretty seamlessly to online school. She attends Detroit Country Day. We're looking at what's going to happen in the fall, though, because we don't know what that's going to look like. We're anticipating online. I'm teaching at University of Michigan, like you were, Dr. Rob, and fortunately, like you, I don't teach in the winter, so I dodged the bullet of having to make that rapid conversion over to online instruction, but preparing to do that for the fall. The worst thing is that, I've lost a few people who are close to me, friends, no family members. But that kind of brought the whole thing home. There's a group of U of M guys who, we call ourselves the OGs, original gangsters. U of M, we went there in the 70s in the College of Engineering, a few of them in the late 60s. And we would get together quarterly for breakfast and just talk about the state of the world and so forth. And so we arranged a Zoom call for late March as a replacement for our quarterly get together, and we just couldn't reach one of the guys, and so we got concerned, and we ended up sending the police to his place to check on him, and they couldn't find him. But one of the neighbors said he was in the hospital. Anyway, to make a long story short, we finally found him, and he was at Henry Ford Hospital. He's still there to this day. He's been in the hospital for more than a month. He went into emergency, intensive care, out of intensive care, back into intensive care. And now he's still, last I knew, he's still being hospitalized. So, it's the kind of thing where it really distresses me to hear people say this is, like the flu, and we should just go back about our business. And, even Elon Musk, I'm a Tesla owner and a big fan of his, but to have him say that, this is fascist, and, nobody has been made to stay at home, and there's a lot of, I'm so upset about the whole thing with the Michigan legislature and, the guns at the legislature and all this kind of, it's just, I'm so concerned about where things are going from here. But again, on a personal note, we're moving ahead, moving through it.
Well,
So thanks for asking.
Glad you're doing well, and I'm sorry for your losses. I think that one of the difficulties of this is that this is such a disease which is spotty in certain communities. It seems to be moving about, but if you don't have somebody who's directly affected by it, I know it certainly changed my view to have my son and his family affected by it. And my 98-year-old mother-in-law moved in with us for 6 weeks and to stay away. And she actually misses her home so much that she kind of insisted in going back, but she has to isolate for 14 days. It's not the way you want to spend your 98 years, 14 days of it in one room, but that's what the conditions for her to go back to her senior residence. Lee, I'm going to go back to you. We want to hear your advice for us, takeaways that you might have for us to be thinking about. You've given us already a lot of good advice, which I appreciate.
Sure. Well, yeah, I think just being thoughtful is the main thing as we reemerge, as the economy opens back up, which it inevitably will. There was a question about we can't possibly stay in lockdown for 2 years until we all develop herd immunity and have immunizations. And I don't think that's tolerable, certainly with that American spirit. People want to be out and about, but just do it thoughtfully. I also want to address, there was a question about what the community can do to help support us. And there's been a tremendous outpouring of support for all of our hospitals. There is so much food coming into the emergency department. I can't say it's the healthiest. I can't say it truly fuels me, but it definitely relieves my hunger. And we're trying to hit all the units. It's not just the emergency department. And the ICUs taking care of our patients, but it's every unit, everywhere in the hospital, from those folks down in the supply chain, the pharmacies, environmental services, everyone. And to be perfectly honest, I think what's even more appreciated, although food is always welcome, are really just the thank yous. Helping reestablish that sense of purpose that some of us may have lost as we feel we're just kind of going through the motions in this kind of ethereal state that looks very little like what we originally trained to function in. I think those go a long way. And I put in the chat box, it is National Nurses Week, and the nurses are taking the brunt of this on the nose. They're the ones who are at the bedside all day, every day, taking care of our patients. So if you were to ask me what would help the most, and going back to Dr. Aronson and Dr. McCurdy about our mental wellness, is a true, genuine thank you goes a long way. A million little things. I don't think there's one big gesture that the community can make, but just the little things really say a lot.
I wanted to say, as a psychologist, a couple recommendations for people. I think having some goals during this time is important. I mean, we usually are very goal-oriented people, but for example, learning something new. I mean, this is an opportunity. One of the joys I've had is my mother-in-law, who's, by the way, not Chinese and is not Jewish, but has been teaching me Mahjong. So I now know how to play Mahjong. If anybody wants to take me on, we need a fourth, so let me know. But I think things like that. And we also then went out and invested some money and bought a nice piece of exercise equipment, because we weren't able to get to the gym, and we've been talking about it. We thought, well, this is the time to do it. We bought local, which is New Step, which is a great piece of equipment that anybody could use for a long period of time. Any other suggestions people have just for keeping wellness going? Allison, are you there? Allison Mankowski still on board? She was going to carry a few stretches for us to do for sitting. Last week we had a really good session on the importance of stretching and keeping limber while you're sitting, and everybody's hunched over. The idea of sit back, use your arm support, don't lean into your computer, but lean back and look at it. So all those things are very important. Keenan, do you have any last comments for us?
Yeah, one of the things that we didn't really talk about here is that even though this is really hitting the healthcare workers, the volume in the emergency department is down, and one of the things that Dr. Aronson and I think Rob Endley and I also sort of are talking about indirectly is that this is all different types of grief. And we're all experiencing grief, grief of the loss of what we thought we would be doing. And for the people who are in the hospitals, because the volume is down and medicine is a volume-based business, we have the financial stress on top of having to deal with that. And so one of the questions, sort of my add-on to what you can do to healthcare providers is stay home when you're sick, but when you think you're sick and you need to come to the hospital, come to the hospital. Let us take care of you. We'll, get the volume back up, which is something that, any business that's volume-based business is going to need that.
So we don't need to be afraid to come?
You don't need to be afraid. We have procedures. We have the ability to test. We have the PPE. Let us take care of you.
Okay, thank you. What about things like getting your annual physical or, just wellness kind of things that you don't need to go for emergencies? Would you recommend people going ahead with those now or not?
Yeah, so the primary care doctor's offices have really embraced a lot of these telemedicine things as well. And so if your primary care doctor's office is offering those, then do it. If they have them non-virtually, and then I guarantee that they have, if they're doing them in person, then I guarantee everybody is going to be wearing masks, and you will be as protected as you would if you were to go to a grocery store. Thank you.
I'm going to keep things going here just in terms of Q&A and open things up. Emily, could you open up everybody's mic just people can ask questions as they wish, or share If you are got something going on in the background, please mute your mic. We had to edit out a personal caretaking event that happened on screen last week, but I won't go into the details. But we could hear it. We didn't see it, unfortunately. So be careful about it. If you're in the bathroom, please clear out. Don't have your mic. Hey, but any comments, questions at this point? I know we got a lot of medical experts on. Dr. Ascione, anything you want to add? Introduce yourself,
Yeah.
Frank.
Yeah, I'm on.
You know lots of folks.
No,
there.
the only thing I would add, I'm
Say who you are, Frank.
yeah, guys. I'm a professor of pharmacy and director of the University Michigan Center for Interprofessional Education. And I think the issue everybody's asking, well, what happens in the future? And as an educator, and many of you are affiliated with the university, so you know what I'm talking about. We're just sort of sitting back, looking at the lessons that are learning, and trying to think about how we then take this new paradigm and change it. So, as a number of people have pointed out, this is a learning situation now. There aren't any answers, but one thing from an educational standpoint that we'll be doing fairly shortly is saying, what have we learned so far? What are some of the stakes? And then helping prepare the workforce of the future with these lessons. It's pretty profound. And so we're looking at it from that standpoint. The use of technology, the relationships between it, but most importantly, preparing the new workforce for dealing with things like this in the future.
Thank you, Frank. Frank has been very involved in helping the schools figure out how to talk to each other, which is something that the medical schools, which are 7 or 8 different departments in a university, Frank?
The 10 health science schools across the 3 campuses, over 5,000 students.
Wow. And they have not had a joint curriculum, so Frank's helping to get that started. Any other comments, questions? I wanted to ask one of the group, and this is something that concerned me deeply yesterday. I heard somebody saying, I don't know whether this is a public health problem or a personal health problem. And I said, well, what do you mean? And he said, well, personal health means like, is this a problem just for people who are at risk? And, people that have comorbid conditions. And could you comment? I know you see you shaking your head on that, Keenan. How would you answer that?
Yeah, so it would be a personal health problem. I think if your decision only affected you, and unfortunately, when you have a disease that has a week-long or 10-day long incubation period where you're totally asymptomatic, those asymptomatic carriers are the ones that are going to be spreading it around. And so you're not really making a decision for your own health. You're making a decision for everybody that you come into contact with. And that just doesn't seem fair.
Yeah, this was a person who had decided to go to a meeting with several other people. And I thought, well, that's not being too smart at this point. But, so the point is that it's not a personal. And I worry a little bit about that term having some pejorative stance too, like blaming the victim, like, oh, this is if you just took better care of yourself, or you just, didn't do this or you didn't do that, or you lost weight, you wouldn't have this problem. Steve, you're shaking your head on that. What are your points of view on it? Steve Aronson.
There's just so much that we need to do in terms of just being together and supporting each other. I was just reflecting right now that I haven't been involved in a informal but formal, organized, systematic, professional level thing like this with colleagues from different sectors until now, and how useful it is. So I want to thank you for that.
Yeah, I think I'm trying to figure out how to go forward with Leaders Connect, and I think having this forum with medical experts is the way to go. I've had 5 different sessions now, and I just would like to hear from my audience about whether you want to have more of this, because there's so many scientists and experts about this disease, and we're learning so much about it. And I feel, I'm maybe eternal optimist about certain things, is that this is a really great opportunity for resetting a society that kind of already had been going off the rails, and that certain things, this is a correction. I'm not sure that's a grand design of anybody, but if we take the opportunity, and in this audience right here, there's a lot of leaders who have the capability of forging what the future will look like. And it will be up to all of us to say what that is. It's not going to be somebody else at this point. So I am optimistic, but we have to have these dialogues to be able to keep that doing, and we have to have the right people involved in the dialogues. Other comments, questions? Deb, I see you out there with lots of good questions as always, and you look like you're out there on the prairies of West Virginia or something. I don't get it.
No, it's Mongolia.
Mongolia, okay.
That's Mongolia.
How could I not have recognized Mongolia?
It just, I really, really appreciate this. I have some friends, former classmates who are convinced that this is all a big hoax. It's a conspiracy. I made a very heated argument recently about some of the videos that have been going on about, I don't even know what it's called, but there's some apparently video that people are now passing around talking about some big hoax. And I really appreciate this forum so that we can really hear what's going on and hear from experts. But I mean, one of the things I think that really that concerns me is I think what Dr. Bora was saying is that this, or maybe it's Dr. Benjamin, all of the doctors are saying is that this is not about me. I wear a mask to protect you. I mean, you know, the mask that I wear isn't going to do anything for me necessarily. It will to a certain extent, but it's more about going out into the community and protecting other people. And my concern is that as, you know, we keep talking about how things are going to change, I'm skeptical that people are going to suddenly become less selfish and see this as a public health issue and look at other people first before I think, oh my goodness, you know, someone was bragging, I finally found a rogue manicurist. I got my, you know, my pedicure done. And I'm like, oh my God, seriously. So my Polish skepticism and cynicism is coming forth, but I very much appreciate all the doctors and thank you so very much. And all the medical personnel. My brother is a pediatric endocrinologist in Rochester, New York, and we periodically talk. And even though he has not seen an uptick in cases with his patients, it's still taken a toll on everybody there. So thank you so much.
Yeah, but those are the first time I've ever heard those two words put together, rogue manicurist. You might have invented a new profession. I'm not sure, but thank you for doing that. Deb, Marion, you've got a lot of comments out there, and you said you'd like to see some women up here. So I need to get some recommendations. I'm going to ask my friend Dr. Ora Peskovitz if she will join us maybe next week, and Quinta Verede. But any other ideas, Deb, for people?
Yeah, I sent you an email about this already a couple of days ago this week, Rob. So I'll resend it if you didn't see it.
No, I saw it.
Okay. So, well, two different women that I was recommending. So,
who are they?
I'll send to you.
Oh, you said privately.
Okay. All right. No problem. Thanks.
All right.
And Rob, the last time I was on this Leaders Connect, we had a Dr. StephenA Simmons on.
Oh yeah, she'd be great. Yeah.
She's the vice president for patient experience and provider engagement, and she's been leading our national provider well-being initiatives across the country, across all service lines. And she does twice a day Zoom meetings and does.
Excellent. Okay, I'll definitely contact Stephanie. I just
like
wrote down Stephanie. Before you said that, I said Stephanie, Ora, and Quinta Verede. So those are my three to go to. But any other comments, questions? I think it may be a good time to wrap up. Thank you all for taking your time, and thank you all for being community spirited and generous in this. And I know, Rob, you've tried to talk to Lisa Berry at WEMU, but Lisa's trying to get some people to talk on her WEMU about this. I think if you could get some clearance about that, that would be great. There's other forums that people in the community are really reaching out to try to continue to educate the community. So thank you very much. And I want to thank Emily. I want to thank Eric Hipple out here, who's a former Lions quarterback, has been doing a lot about mental health. Thank you for joining, Eric. And we're going to make this available by Monday. We'll send out the video of this. That'll be on my YouTube channel. It'll be between my hip hop video and my country music videos, so you can check it out there. And Keenan, I have one other question for you. This is an important one. Games to play. Keenan is one of our best game players in the world. Yeah. So
Wow. Yeah.
recommend?
So it's a good question. There are some community games that you can play. I mean, there are a lot of good ones you can play just with your family, but you can.
How about online games that we could play?
Yeah, you can still. Well, you can still do Pictionary.
Pictionary, okay.
So that's one that you can do, and then you can modify the rules a little bit. There's some things online you can look up for that. But Pictionary is probably the best one. But there are lots of good online games.
What's the latest new one that you're really excited about? Keenan is a world's expert on games. Playing games.
You know, I play a lot of board games, though. I don't do a lot of online games. But I have the one that I would say a lot of people have been playing. There's one called Stardew Valley.
Say that again?
So Animal Crossing. Stardew Valley and Animal Crossing. These are very contemplative and mindful games where there's very little conflict, and your idea is to just sort of set up an area that you feel in control of.
Okay.
And so
are two people games, or
with a little bit of escapism by giving them an area where they can have control and there are no negative consequences as a little bit of nice escapism.
Well, I think this is I think that you ought to start a blog on games to play during the coronavirus. This might be your opportunity, Keenan, for real fame.
Nice.
Well, thank you, everybody. Take care. Be well. Stay connected. See you hopefully next Friday.
Thanks.
Annie, look for you in the park.
Definitely. See you, Rob.
Okay, I'll be out there today.
What time?
I don't know yet.
See you out there.
Bye-bye.
Bye-bye.